Well, capacity strengthening, capacity is the ability to do, and to strengthen the ability to do raises the question, the ability to do what? And it is known in the global health community that there is a move towards malaria elimination and malaria eradication. And in order to be able to eradicate malaria, you need to be able to address the issues of proper treatment, the issues of adequate prevention, and above all, surveillance, which is really the key to be able to eradicate malaria completely. To be able to carry out all these activities, you need human infrastructure and you need material infrastructure. Therefore, people need to be able to have the skills that they need to carry out the activities they need to carry out. And even beyond that, we need to be able to determine which kinds of activities we need to carry out in order to achieve the goal of eradication of malaria. So therefore, there's a need for people to get trained. There's the need for people to be sustained and have clear career paths and career goals. And there's also the need to be able to groom up and coming researchers also to be able to take over from those who are leaving the scene. Without being able to strengthen capacity, it is well possible that whatever gains have been made may be completely eroded, and we may even move to a situation which is worse than what we already have. Well, yes, the Confounder Teaching Hospital Research and Development Unit, at the time I was leading the unit, was involved together with DNDi in carrying out the independent evaluation of the AMFM in Ghana. It was a unique collaboration with DNDi in the sense that DNDi was directly responsive to the Global Fund, while our unit at the teaching hospital was relating with DNDi and also with the Global Fund. It was important for the teaching hospital in the sense that it involved relating with national level institutions like the Ghana Statistical Service, the National Malaria Control Program, and the Ghana Health Service in order to get key parameters which were put into the survey design and even into the analysis of the data that we collected. And through that activity, we're able to learn complex survey design, methodologies and approaches, ways of managing large national level surveys, and also the kind of material infrastructure it brought to the teaching hospital was useful in the form of various kinds of devices that can now be used to conduct other kinds of important field research. Well, capacity strengthening in Africa is a very wide issue, and there are varying levels of capacity for research across Africa. A good resource to refer to would be the African Network for Drug Diagnostics and Innovation, which was involved in mapping the capacity for research in Africa. I was actually involved directly with that kind of work. And very early, at the inception of DNDi, right here in Nairobi, almost 10 years ago, I was also involved in some work which looked at trying to map the capacity in Africa. So the capacity varies across the continent. It varies depending on the specific kind of disease that there is. But I think that the most important thing when it comes to capacity strengthening in many African countries is the ability to generate our own questions of interest and pursue a country or continent or regional, perhaps, driven agenda, and being able to produce answers or results that are directly beneficial or directly applicable to health policy, which can improve health outcomes. And I think the capacity to be able to generate these questions and to research them to come up with the critical answers is what may be lacking presently, and I think needs to be focused on to a large extent.